Medicare has been around a long time, helping Americans get the health care they need since 1966. But it hasn't always provided coverage for prescription drugs. In 2006, Medicare introduced Part D, a prescription drug benefit. Here's how it works. Part D is available through private insurance companies. All Part D plans have to meet standards set by the government, but after that, plans can vary, with different monthly premiums, different costs for drugs, and even different drugs that are covered. If you want to see which drugs a plan covers, they're listed in a document called a formulary. Every plan has one. You can get Part D as a standalone drug plan, or you can get it as part of an all-in-one plan that combines your medical coverage with your drug coverage. These all-in-one plans are called Medicare Advantage prescription drug plans. Now, if you want Part D, when should you enroll? The most common time to enroll is when you first become eligible for Medicare, which is usually when you turn 65. You can also enroll during the annual open enrollment period, October 15th through December 7th each year. You can enroll outside of these regular enrollment windows when certain life events occur, like retirement. Keep in mind, if you don't enroll when you first become eligible, and you decide that you want Part D later, you could be charged a monthly penalty. You don't have to worry about penalties if you have other drug coverage that meets Part D standards. That's called creditable coverage. Here's how your drugs are covered. Part D coverage has 4 stages. Each stage has a different level of coverage. You move from one stage to the next as your drug costs add up over the year. The first stage is the deductible. This means you pay the entire cost of your drugs, out of pocket, until you reach your plan's deductible amount. After you pay your deductible, you move to the second stage, where your plan covers your prescriptions and you pay either a copay or coinsurance set by your plan. This coverage continues until your drug costs reach $3,700. That total includes what you've paid out of pocket, plus what your plan has paid. Most people don't reach this amount, but if you do, you'll move into the third stage, the coverage gap. It's sometimes called the donut hole because you have less coverage until you spend $4,950. That total includes everything you've paid out of pocket for your drugs from the beginning of the year. It also includes the dollar value of discounts that drug manufacturers apply to brand name drugs in the coverage gap. When you reach this amount, you move to the fourth stage, where your health plan kicks in again with more coverage. Now you pay less for your drugs until the end of the year. On January 1st, the whole thing starts over again. Luckily, you don't have to keep track of all these numbers. Your plan will do that for you. And each month, they'll keep you informed about how close you are to the next stage. So that's how Medicare Part D works.
For more information, visit medicare.gov or go to Kaiser Permanente's website, kp.org/wa/Medicare. Thanks for watching.